So I've done a few presentations. They're mostly for dermatologists, but what I'll do is I'll just make it more simple for everyone to understand. If you've never, if you've never done chemical peels before, if you're currently doing chemical peels, I just want us, by the end of the session, for everyone to be confident enough to try the chemical peels. The reason why I love Aesthetics, the Manaal company as well, is because when I was doing my training, that's the products I used to train with, and then I carried them to Kenya. I remember that was a long time ago in 2016, and then I started using them in my practice. So when I first started, I used to practice on my mom. Thank God I have 4 sisters, so they were all my guinea pigs as well. And also with Botox, that's how I started, is to practice on everyone first. The people who are very close to you, because if anything happens, of course, they'd never sue you. And then confidence comes. So it's never, when you start, always the best way of learning is through practice and practice and practice. Once you have that confidence, then now you can actually do it for your clients, for your patients, and it just becomes like a normal daily routine. But there's some things that I was never taught, and then I learned with experience. And there's something that you're taught and it just sticks with you forever. Is that okay? So I want everything today just to stick with you. And just remember, at the end of the day, it's you want to be happy with the results, and your patient is actually waiting for those results. Yeah? So how do we get that? It's very simple. The products are very simple. We're only going to talk about the ones that I feel make a difference. I've tried so many, so I've just narrowed it down. I think, Dr. Alfie, to what we have available in the market, right? I know currently some of the products are not in stock. I finished them at Vivace, but we're getting them on Wednesday. Is that okay? Perfect. Okay. So we'll first go through understanding skin layers and performing effective skin analysis. Welcome to this session on skin analysis and skin conditioning as well. Do you all know what skin conditioning is? So when before you do your chemical peel, you have to first condition the skin to make it what you think is desirable before starting the chemical peel. You don't just get a patient and say, today we're going to do a chemical peel. You first plan it out, maybe even a week or 2 weeks prior, and then book your patient for a session for the chemical peel. So we just don't do a chemical peel on the first day. Is that okay? Okay. So the anatomy of the skin is very, very simple, but also very, very complicated. Just to simplify it, we have basically the epidermis, I'm sure you all know, and we have the dermis, okay? And the hypodermis is basically part of the dermis, but very, very deep, yeah? And that's where we have the fat and connective tissues. Most of the remember we're talking about chemical peels, okay? Most of the chemical peels do not reach the hypodermis. That's the down layer, okay? Our chemical peels, if they're very superficial, the ones that we're talking about today, because I think if you're starting out with chemical peels, start with the superficial ones first. You'll build more confidence, and then we'll go to the medium depth chemical peels. So for the superficial chemical peels, we're only targeting the epidermis. For medium depth peels, we're targeting deeper than the epidermis, which we're targeting the dermis, okay? The whole point of chemical peels is to rejuvenate your skin, make your skin look better, help you with the scars, help patients with hyperpigmentation, just basically help you with cell turnover. Is that okay? Cell turnover means removing the dead skin from the bottom, coming up, and just shedding off that skin, okay? So the epidermis has many layers, and usually what happens, it takes about 21 days for the keratinocytes at the bottom of the epidermis on the basal cell layer to come up. The whole point of chemical peels or exfoliation is just to get that moving faster, okay? So when you're younger, the turnover is faster. When you're older, it takes more time. And that's why when you reach 40, 45, your skin becomes more dull if patients are not using, or clients are not using any exfoliative products, okay? For the dermis, like I said, it's about collagen. You want to stimulate your collagen. There are chemical peels that go deep to the dermis and cause stimulation of collagen as well. But I feel like when you first start with your superficial peels, when you build your confidence, then now you can move to your deeper peels, okay? You've heard of phenol peels, like very, very deep peels, usually we have to tell a patient to stay at home, not going out. We remove the whole of the epidermis and dermis as well. But currently, we're not doing that anymore. I prefer doing lasers for that. So the CO2 lasers to remove the top layer of skin. Is that okay? Yes. Reason is because of the side effects as well in monitoring the patient. Yeah? Okay, so then the hypodermis. How you reach the hypodermis? Yes, you could reach with the chemical peel, but it's very, very aggressive. I've never done any chemical peel that reaches deep down to the hypodermis. What I love to do for the hypodermis stimulation is usually microneedling, okay? Now remember, with microneedling, you have those channels open for about 4 minutes. You can put any ingredient you want in 4 to 6 minutes, yes? To reach deep down in the hypodermis. That's the hyaluronic acid, whatever you think you need. We also usually put peptides and all those other things, okay? Yes, so when you first see your patient, so we have to go through in terms of classifying a patient according to their skin type. So Fitzpatrick classification. I don't know if you all understand that a chemical peel for dark skin is not the same chemical peel you use for a light skin. We all understand that, right? Reason is, for darker skin, they have higher risk of hyperpigmentation. So maybe they came to you with an issue of hyperpigmentation, okay? And then you just decide and do a chemical peel on them. And then they come back to you 2 weeks later, their hyperpigmentation is actually worse, yeah? Reason is, you didn't maybe do the right chemical peel for them, or maybe you didn't leave it for the right time, or the right duration. So what you need to do is first have, maybe I can share with you what I usually use in my clinic. We have like a chart and ask patients a few questions and classify them according to what skin type they are, what skin conditions they have, and then what I feel would be the best chemical choice for them. Is that okay? Yes. So this is the thing, what I was telling you, like we ask them the skin type, if they have any pre-existing conditions, and what, as a clinician, you feel, or the esthetician, you feel is the best choice. So the best thing, when your patients are waiting for you in the waiting area, you get a good history in terms of their past history as well. Do they have any allergies? Because, for example, for salicylic acid, if anyone has any allergies to aspirin, you wouldn't do a salicylic acid peel. We all know that, right? Okay. If not, just make sure you write that down. I've had an allergy before. A patient of mine, it was really, really bad. This was about 2 years ago. We even had to do for her IV hydrocortisone because of the allergy. So it's really good to take a proper history. I have some documents that I usually give my patients. I'd love to share with you. Just a questionnaire, a really quick questionnaire of just to get to know the patient before you even see them. Is that okay? Yes. So this is the Fitzpatrick scale, skin type 1, 2, 3, 4, 5 to 6. So when you're doing chemical peels, you need to assess your patient, what skin type they are. Do they have blonde hair? Do they have black eyes? Do they have blue eyes? So this scale will tell us what type of chemical peel to use, and we'll go through that today, okay? Honestly, Dr. Alfie put this for a skin analysis machine. The best skin analysis machine is your eyes. No machine can tell you a skin condition better than your eyes, okay? Reason is, what if maybe that day the patient didn't drink enough water, and then they look dehydrated? The skin analysis machine will tell you the patient has dehydrated skin and maybe needs more hyaluronic acid on that day, right? But examining a patient with your eyes using just like a magnifying, like a dermoscope, yeah? You just hold it and just examine with the light. Really, that's the best way of knowing a patient's skin. I don't have a skin analysis machine in my clinic, and I just use my eyes, and I feel that's the best tool you could ever use. So don't invest in any machine. I see a lot of clinics have big machines in their clinics to tell a patient maybe what products to use now, what products to use after, but honestly the best tool are your eyes, okay? Yes, so a step-by-step skin analysis protocol. You need to do the pre-consultation first, so give the patient your form and the consent to sign. Whenever you're doing a chemical peel, even if it's a spa, just always have a consent form and a patient signing that she understands the risks involved when it comes to chemical peel. For microneedling, I do the same. Do you guys do the same for microneedling? You have a consent form? Yeah, always make a patient sign. Especially now because there are many clinics, in town. You don't want to, your name is very, very important in terms of just, not having any problems. Even if you do, you have yourself covered. So make sure your patients are signing. For facials currently, our patients are also signing that she understands the risk involved when it comes to facials. Okay, with anything, just make sure your patients are signing. Then we always go through the routine, the allergies and the history. And then remember, you cleanse the skin for accurate inspection. You can't expect skin when someone has makeup. Yeah, of course, with foundation, with concealer, you don't really get to see that skin. So you need to tell the patients to remove the makeup. I usually have wipes in my office. We wipe the skin and then just see the condition of the skin first before doing anything. And then, of course, examination with tools. Like I told you, your eyes are the best. And then identify the type, condition, and the skin Fitzpatrick scoring system, and then document findings and plan. What do we want to achieve when we are conditioning the skin? So it's to improve external appearance, okay? Respecting the skin type. Remember, darker skin, like I mentioned, has a risk of pigmentation following trauma or any type of inflammation. You want to do a chemical peel without complications. How many of you have done a chemical peel on the first day you've met your client? Have any of you done a chemical peel on the first day, or do you usually plan? Usually plan? Yeah. How many days do you plan before chemical peel? Okay. So I at least 5 days to 14 days. Okay, so if you have a client and she's coming in and she wants, the first day she's like, I want a chemical peel. Tell her, we first condition your skin for 5 days to 14 days before doing a chemical peel. So today I'll teach you what to do for skin conditioning before doing that chemical peel. Why? Because you get really good results if your skin is first conditioned before doing a chemical peel, okay? So it improves physiological functioning, so the healing and the barrier of the skin, if you do the conditioning before your chemical peel, it's much safer. She won't call you with irritation or redness or itchiness of her skin because of the chemical peel, okay? And it improves your results as well. You get rapid results, and skin conditioning prior to procedures ensures more effective results, reduce complications, and higher patient and physician satisfaction. Is that okay? Okay. A lot of people don't do skin conditioning and they just do a chemical peel. But from now, I think it's good for you to understand that's the most important thing, okay? Yes. So chemical peels are an effective way to rejuvenate your skin, remove minor imperfections, wrinkles and scars, and achieve younger looking complexion. Essentially strip away the outer layers of skin. This is the epidermis, right? And to allow smoother, younger looking skin to grow in its place, and also it just, like we said, the turnover becomes faster, so the cells just renew really faster, and the patient is really satisfied by just having good, not glass skin, but just almost glass skin. Is that okay? So you could use it for scars, for acne, for hyperpigmentation, for just dull skin, for other conditions, for example, actinic keratosis. Other medical conditions as well, we use chemical peels for that, okay? Yes. So the goal of skin conditioning is to speed up the healing process, to avoid complications, and to obtain faster and better results. So the target, what are we targeting with skin conditioning? We're targeting keratinocytes, the cells in the skin, melanocytes, the melanin producing cells, fibroblasts, that's the collagen, and dermis vascularization. This is basically blood supply. We want good blood supply when we're doing a chemical peel, okay? Okay. So that's just the structure of the epidermis. This is basically the cycle of how the cells from the lower part of the epidermis, when it's detached until it detaches. As you can see, it takes about 28 days, plus or minus 10 days, okay? Yes. Available products in the market. Many people will come with different companies, okay, telling you that the products are the best. Of course, they're amazing. There are many products that are good in the market, okay? But you need to also know in terms of the pH of the product. That's the first thing to ask someone whenever they're selling to you chemical peels. The pH of the product, how long you keep the product for, how do you neutralize the product? Okay, there's some that self-neutralize, there's some that you need to neutralize with water, there's some you need to neutralize with bicarbonate. You need to know how to neutralize. Do you usually fan the product on when the patient has the product on? So these are very important questions, because you could have one product that maybe the company tells you it stays on for 15 seconds, okay? But other patients, maybe in just 10 seconds, you need to wipe it off. So what are the signs of, for example, when you apply the chemical peel that tell you that you need to wipe off the product? So these are the things we'll go through today, and practically we'll also see, yeah? Okay. So preparation of the skin, so you're selecting your product selection. You need to first, of course, consider the cleanser you're using for the patient prior to the chemical peel, yes? Which cleansers do you usually mostly recommend? Do you have one standard cleanser to your patient, to your client, or different cleansers for different skin type? In practice, different, right? So for oily skin, you use maybe AHAs and BHAs, right? For like normal skin, a hydrating cleanser. For very dry skin, a hydrating cleanser, right? Before a skin conditioner, before doing a chemical peel, okay? Then a toner, of course, to restore the normal pH. Remember I was telling you pH is very important on skin. If your pH of the skin is very acidic, we will have a problem when you're doing a chemical peel. But when you just apply the chemical peel, a patient will start complaining of burning or tingling, okay? Then remember, topical antibiotics. So why I removed oral antibiotics is because that's for a doctor to prescribe. But a lot of topical antibiotics like clindamycin are okay for you to prescribe, I think, as an esthetician, because if you see any pustules, so pustules are like small bumps with white, yeah? If you see any of that, it's okay to prescribe an antibiotic, okay? So the first step is exfoliation. So this will talk about skin conditioning, yeah, for the first 5 to 12, 14 days before doing a chemical peel. So you could use the AHAs, of course, which are very light exfoliant, and then maybe give a patient an aloe vera moisturizer to use. So let's take an example. We see Catherine, okay? Then I'll ask Catherine, are you currently using anything for your skin? And she's coming for a chemical peel, maybe just for rejuvenation, okay? And she says she's using a basic cleanser. I won't change it for her if she's already used to the basic cleanser, and maybe I'll just add an AHA, a small AHA, something very, very mild in the market. Currently there is this brand, I forgot the name, yes, Biotex, it's a cleanser as well, and a BHA, you've heard of the CeraVe Blemish Control Cleanser, yeah, it's very mild, it's like 2%, yeah. We also have the DP Tri-Phase Cleanser, which is also amazing as an exfoliation, and also, I don't know if you've seen this micro exfoliant, I don't have it here. It's micro exfoliant. It contains lactic acid 5% with bamboo extract. It's amazing just for a mild exfoliation. So you could give your patients that if they can afford. Okay? And then the step 2 is when you have a patient, this is now the secret, okay? When you have a patient with hyperpigmentation, yeah, and they want to do a chemical peel, do not do a chemical peel for this patient without giving them a lightening ingredient first. Reason is they could get hyperpigmentation from the chemical peel. So there is a product which is a combination of, we're talking about Fitzpatrick classification, skin type 5 and 6, okay? So darker skins. Lighter skins, they're not at risk of pigmentation. Very, very low risk. So you give a patient a combination of tretinoin, okay, maybe it is 0.025. There are in the market a few, okay, 0.025%. Combine it with hydroquinone, 2%. Yeah, don't go more than 2%. And a very mild steroid, maybe mometasone mixed together. It comes as a tube, 3 things combined into one in combination. So originally it was formulated by a man called Kligman. He was a scientist. And it's called the Kligman's formula, these three things. So in combination, what do? The hydroquinone will lighten the hyperpigmentation of the patient, so suppress those melanocytes, okay? The steroid will prevent, hydroquinone can cause some irritation, right? So the steroid will help the irritation of the counteract the irritation of the hydroquinone, okay? And the tretinoin in there will actually help you with the cell turnover. So any patient who has hyperpigmentation, if you're asking melasma, okay, give them this first, yeah, and then do the chemical peel after. So what many people do is they just run to a chemical peel first. You won't get really good results. The patient will be so happy if you first condition the skin and then put the chemical peel after, okay? So 2 weeks for melasma. Don't do melasma until you condition the skin for 2 weeks prior doing a chemical peel, okay? So this is the gold standard, the 2% to 4%, and then of course 2 weeks prior. Don't do more, just 2 weeks is enough. Then step 3, stimulation. Like what I said, the retinol or retinoic acid, I love 0.025%. Most doctors would prescribe 0.1%. I feel it's too harsh. Imagine if someone has never used retinol and then you just prescribe a very high concentration of retinol. It's quite high. Stick to the basic, you won't have side effects, 0.025, that's the percentage. Okay, so it acts on fibroblasts. Remember I told you there's some things that can actually cause stimulation of collagen? Retinol is one of them, okay? Now, this is usually how it's converted. Retinol is usually converted to retinaldehyde, to retinoic acid. Then retinoic acid is usually the most concentrated form. So we're just sticking to retinol, yeah? Okay. Then, of course, the topical antibiotics. Aloe vera I love, but do you know that some patients are allergic to aloe vera? And that's why the first thing is to ask in that tick sheet, do you have any allergies to aloe vera or anything? Okay, I've done a procedure before. I put aloe vera in a patient. She didn't know she had an allergy, and immediately she had erythema, swelling, puffy lips, everything. Her eyes became puffy as well. So it's good to ask questions first, okay? And then remember, for the 2 weeks conditioning, make sure your patient is using sunscreen. So remember the trilum I just told you about, the Kligman's formula, the tretinoin, hydroquinone, and the steroid. Always make sure your patient is wearing sunscreen during the day, because that medication is only for the night. And how much do you put? You have to explain to your patient. Half of a pea size is enough for the whole face. Half of a pea size. Sometimes you find a patient putting like a whole finger length. So tell them half of a pea size is enough at night, and then during the day, please wear sunscreen. They have to wear sun protection, okay? Yes, so what are the anticipated reactions you might see when you're doing skin conditioning or even during chemical peels, for example? If you use too many products during the skin conditioning phase, patients can complain of redness, dryness, itchy and burning sensation, flaking, or even worsening of the skin. That's why it's very important to use very mild products for exfoliation, AHAs. Stick to your AHAs, it's very mild, and just sun protection during the day. Don't try and treat any skin during the day when you're doing your skin conditioning. Is that okay? Please feel free to ask any questions while we're going. I don't mind. Okay?
I have a question actually.
Mm-hmm.
So you talked about that before, during the skin conditioning.
Yes.
So it's the topical antibiotics that they'll apply to the 2 weeks?
Yes. So you, as an esthetician, you have the right to do that.
Okay, but is that for everybody or just people with the acne?
Only with the acne. So you've seen, you know how pustules look?
Yeah.
If you see patients with pustules and you feel like they'll benefit from an antibiotic first, because before you do, if you do your chemical peel and you've done that first, you get better results. Yes. Okay. And there's also really nice, if I don't know if you've heard of probiotics for the skin. They are currently in the market. You just apply on the skin. It works really, really good before chemical peel. Okay. Yes. So always ask patients, tell them about the instructions. So refrain from other chemical peels as well. In the 2 weeks leading up to a chemical peel, remember that they shouldn't be using any chemical peels at home. We currently have in the market chemical peels that you could use at home, like the Uber Peel Pro. We usually sell it to patients and we give it to them to use every 2 weeks. So if a patient is coming for a chemical peel to our clinic, I make sure they've stopped everything, okay? We assume they know, but they usually don't know, yeah? And then avoid tanning booths for 2 weeks because of the UV radiation. Take antiviral medications as needed. Now this is where the question is very important, because you've heard of mouth herpes before? the oral herpes and around the mouth. When you do a chemical peel, sometimes when a patient has recurrent oral herpes, it could aggravate, okay, that issue. So what you do when you've asked the patient if they've had any history of that, you usually give them medication first, or ask them to see a dermatologist first before doing a chemical peel. For superficial chemical peels, I'm not usually very worried about it, but for medium peels, I usually ask patients a lot about any use of antiviral creams around their mouth. Okay? So then, of course, you tell them also to limit sun exposure and be gentle on their skin. They shouldn't be doing any waxing, threading, hair removal prior, a day or even 4 days prior a chemical peel. Is that okay? Did you guys know this? So you shouldn't be doing threading, waxing, or laser before chemical peel. Yeah? Then if they're doing Botox and they're doing fillers with you or with someone else in your clinic, just always make sure that they have first maybe done the injectables before doing the chemical peel, but at least give it a few days apart, maybe 4 to 6 days apart. Okay. Then apply the prescribed medication for the skin and apply the retinoid cream, which I've told you about, and it should be 0.025%, nothing more. Don't prescribe anything more. Okay. And then use a bleaching agent. I've told you about the hydroquinone in combination. I wouldn't want to confuse you and give you different prescriptions. There is one in the market with all the three in a combination form. Is that okay?
So I'm sorry, for
Yes.
asthma you're using combination.
Yes, Triluma.
For acne, what's another one?
For acne, now we do the AHAs, the BHAs, skin conditioning. Of course, if a patient has no risk of hyperpigmentation, don't give them the Triluma. Triluma is only for a patient who's come to you because she has melasma or she has hyperpigmentation, then or post-inflammatory hyperpigmentation from acne scars, for example. Then you give them the Triluma cream. Not all the patients. For acne patients, that's very important, thank you. For acne patients, please do not give them the combination treatment. Why? The steroid in it, which is the mometasone, would suppress the acne. Okay? It's an anti-inflammatory. So acne has bacteria, and then you go and give them a steroid. You're suppressing the problem. And then once you do the chemical peel, the problem will become worse. So don't. Triluma, the three things I was telling you about, is only for melasma or hyperpigmentation. Please just write that down. Is that okay? For acne, AHAs, yeah, we give them AHAs, we give them BHAs, a topical antibiotic, and really good hydration for the skin. Remember, even for acne, they need moisturization because their barrier is already compromised. And then you come put a chemical peel on top, you make it worse. So they might even have a flare of the acne after you've done a chemical peel. Yes.
You use salicylic acid?
Yeah, salicylic acid is really, really good. Yeah, salicylic acid is amazing. Yeah, I love lactic acid. I like it more. Yeah, of irritation, it's less irritating. Yeah, I like lactic acid more. Okay. Any other question? Yes. Yes.
What is the precondition?
I'd say for that, it's really important to first see a dermatologist, because I wouldn't recommend doing a chemical peel when a patient has fungal acne due to a fungal infection. Yeah, so any type of infection, like what we're going through right now is just basic acne. The first one, comedones, a bit of pustules. That's what I'm telling you. You could prescribe the clindamycin gel. That's okay. But for anything more severe, like a grade 3, grade 4 acne with nodules and really big cysts, chemical peels, they need first oral medications to see a difference, and then you do the chemical peel. Okay, so they need maybe the Roaccutane, it's an oral tablet, vitamin A derivative, or they need an oral antibiotic maybe for about 4 to 6 weeks. So for that, maybe a doctor can prescribe, and then you can do the chemical peel. So you could send them. I get a lot of patients from estheticians coming for prescriptions, and then I always advise them to go back to the esthetician for the chemical peel. And then I discuss on the phone with the esthetician, like, do this one instead of this chemical peel, she'll benefit more. Yes. Okay?
Sorry, I just want to
Sure.
get like we have the clients here and she's coming in for the first time. She wants to do a peel. So if we're just talking about like the lineup,
Yes.
would it be like AHA, BHA, cleanser, and then a glycolic or lactic exfoliant, the antibiotic, aloe vera moisturizer, sunscreen?
Yes.
That would be?
Yes.
Okay,
Yes.
so you would still, even if it's like you're going to do it in 5 days, you would still prescribe that she uses an exfoliator?
Yes, yes. Reason is we get better skin. We get the better results with the chemical peel. Yeah, but also the percentage of the wash is very important. Currently I'm using a glycolic acid wash that is 20%. Now I can't use that face wash of mine and I have a chemical peel next week. So I'll maybe use my 5% and then plan for a chemical peel next week. Yeah? So percentage is very important. But as long as you have a very mild exfoliator for 2 weeks prior chemical peel, you're okay. Your patient will be very happy. Yes.
Talk about products to include in the conditioning. Are there products to avoid in that same period?
Yes.
7 clients routine.
Yes, yes, of course. We're coming to that. Yes. Okay, so patient instructions. Remember, there's some drugs, this is not for you, it's a bit more complicated, but there's some drugs that are photosensitizing drugs, meaning when you go out to the sun, they cause you to become more sensitive to the chemical peel in 2 weeks. Yeah, so we just make sure we usually just ask patients for the history. Like for example, there's some antibiotics, tetracyclines that make you more photosensitive to the sun. Also antidepressants. Yeah? Then avoid smoking. Of course, why smoking? To increase blood circulation to the skin. So for every cigarette my patient smokes, I tell them you need 1,000 milligrams of vitamin C. So if you're taking 4 cigarettes, you need 4,000 milligrams of vitamin C as an antioxidant effect. That's a lot, So imagine what it's doing to your skin. Yeah, okay. So I tell them don't smoke. I mean, it's difficult, but just reduce your smoking, get better results of a chemical peel. These small things really do matter. Okay? Then taking the antibiotics the doctor has recommended, they should take them, but then they should stop maybe 24 hours prior. Reason is this is for more very deep chemical peels because of the bleeding and all that, but this is not for you, so don't worry about that. Okay, we're done with that. Yes, the next one I'll discuss about what you avoid.